hope you guys are making sure you are brushing your teeth, flossing your teeth, and taking care of your mouth, because if you don't, you can be at risk of developing periodontal disease. Periodontal disease are highly prevalent and can affect up to 90% of the human population. Gingivitis, which is the mildest form of periodontal disease, is caused by bacterial biofilm, which is plaque that gets on your teeth if you don't brush your teeth or floss your teeth as much as you need to. So in this speech, I will be informing everyone what periodontal disease is, how it affects your interpersonal communication, and how to prevent yourself from getting periodontal disease, and how to treat yourself if you do end up getting periodontal disease. So I decided to talk about this certain topic because my great-grandmother, who recently passed away about a year ago, she actually had periodontal disease. So I thought it was really interesting to talk about it and to inform my audience about it so they can know what periodontal disease is and what it does to your mouth and your teeth and how to stay away from developing it. So she was about 92, so she couldn't really brush her teeth, or she didn't really know how to do any of that anymore. So her teeth were really like all falling out because of how bad it was. And whenever you get old, your teeth already naturally fall out, so it was really nasty, and you get really nasty stuff on your teeth and your gums get all red. So yeah, eventually all her teeth fell out. So yeah. So if you don't want to get periodontal disease and you don't want to experience that, because this can happen at any age, believe it or not, you need to make sure you follow all these steps that I'll be teaching you in this speech. So this is what periodontal disease actually looks like. Sorry. You get a bunch of plaque all around your teeth. Your gums get really, really irritated and they get really red, and eventually they fall out if you don't do anything to prevent it. So make sure you brush your teeth and take care of your mouth so you do not get periodontal disease. So believe it or not, periodontal disease is really, really common, like really common. And everyone has inflamed gums every once in a while, but this is what they look like if you don't know what I'm talking about, which I'm sure y'all do. It's really red right here, and it hurts really bad. And whenever you touch it, it's really sensitive. So if you don't brush your teeth, you don't floss your teeth twice a day, or don't use mouthwash, or don't take care of your mouth, you can be at risk of developing inflamed gums, which eventually leads to periodontal disease, or can lead to periodontal disease. So not only do you need to make sure you take care of your overall mouth and your teeth, you need to take care of your mouth because it can affect your overall health, and it can lead to your brain, and it can lead to your heart. So this is a picture that I found online that showed periodontal disease in your mouth and how it can lead to your heart, and it can cause many problems with your heart. And so that's why you need to make sure you stay away from periodontal disease and make sure you do anything you can to try not to develop this, so because it can lead to many other diseases and many other problems. So now that we're done with that, I am going to teach y'all how to prevent yourself from getting periodontal disease. So generally, you need to obviously floss your teeth, brush your teeth twice a day, use mouthwash. You guys know how to brush y'all's teeth. So I wrote down 4 steps to prevent yourself from getting periodontal disease on one of my slides. And the first one was, obviously, brush your teeth at least twice a day. And you can even brush them after small meals or after a little snack you've had that day, just to make sure you get everything out of your mouth so you don't have it in your mouth for the rest of the day, or until you brush your teeth at night. And after you brush your teeth, rinse your mouth out with mouthwash. This is really important, because even after you feel like you've brushed your teeth, even after you feel like you flossed your teeth, you need to make sure you have mouthwash in your mouth because it gets rid of all the extra germs that you can't get rid of with just brushing your teeth. It gets rid of all the nasty stuff in your mouth that you really need to make sure you get out. Okay, the third thing is make sure you floss your teeth. That is really, really important. Flossing your teeth is really important because you get extra food that you can't get with your toothbrush. And if you don't floss your teeth, the extra food that is just left in there will just be left in your mouth for the rest of the day or until you brush your teeth again, if it even comes out again. And it can get infected and it can cause inflamed gums. So now, the fourth thing that you need to make sure you do is make sure you visit your dentist. I know sometimes you don't want to go to your dentist because it's scary. I know everybody doesn't want to go to the dentist. I hate the dentist, but you really need to make sure you go because your mouth is really, really important. I mean, that's how you talk, that's how you communicate, and make sure you just visit your dentist so they will tell you if anything is wrong with your mouth and if you have periodontal disease. So the next thing you need to do is treating periodontal disease. So whenever you treat periodontal disease, it's really the same as, preventing periodontal disease. There's not a certain treatment unless it gets super bad, and that's extracting all of your teeth. So if you have really, really, really bad periodontal disease, you'll have to go to the doctor, and you can get even jaw surgery, and they have to take out all your teeth. And I know I don't want that, and I'm sure none of y'all want that. So just make sure you take care of your teeth. So to treat it, really all you need to do is basically the 4 steps that I've already showed you how to prevent it. Is just brush your teeth, floss your teeth, make sure you do that twice a day, even after small meals. Use mouthwash, and then visit your dentist. That's what you have to do if you want to treat yourself if you do end up getting periodontal disease. So here are some facts that I found online about periodontal disease, just so you guys can know some facts, so you just know. The first one is men are diagnosed more than women. So men, you need to make sure you do these, do all the steps that I just showed you more than women do. Then second thing is pregnant women are, if they have this disease while they're pregnant, they can give birth to their child prematurely. So if you're pregnant, make sure you do not get periodontal disease because you can have your child prematurely, and that's not good. 30% of people develop gum disease by genetics. So if your parents have got periodontal disease, you can get periodontal disease too. So make sure you prevent yourself from getting that so your kid doesn't have it. And the last thing that I found online is that if you're 35 or older, you can lose more teeth from this than from tooth decay. And that shows something. So if you're 35 and older, or around that age, make sure you treat yourself and prevent yourself from getting this so your teeth don't fall out. So overall, you need to remember to brush your teeth and floss your teeth twice a day, and you need to remember all the 4 steps that I taught you to prevent yourself and treat yourself from getting periodontal disease. And I hope you guys learned something today, and thank you for watching my speech.